Gentleman yields back, and I recognize Dr. Schrier from Washington for her 5 minutes questions.
Thank you, Madam Chair. As a pediatrician, I have always relied on trusted experts at FDA and CDC to help me make the best decisions possible when I am taking care of my patients, and they are being purged. Madam Chair, that is why I'm joining all my Democratic colleagues in calling on this committee to hold an oversight hearing to investigate the firing of CDC Director Monarez and the subsequent departure of several CDC officials who were unwilling to abandon science and bend a knee to our conspiracy theory-driven HHS Secretary, RFK Jr. We have in this committee oversight jurisdiction, and we cannot stand by while Secretary Kennedy discards decades of American medical advancement and jeopardizes all of our health for the sake of his own fringe anti-vaccine agenda and a very profitable anti-vaccine industry. Our children deserve better, we deserve better, and we have jurisdiction and a responsibility for oversight. Speaking of children, I'd like to discuss AI tools that are currently used on children. According to the American College of Radiology, over 200 FDA-approved AI tools are used for medical imaging, but only 6 are actually marketed for pediatric use after review by the FDA. That is a staggering disparity in innovation between adult and pediatric care. And partly that's because it's much easier to develop AI imaging software for adults. It's trickier to do it for kids because they're not just little adults, as you said. Bone, heart, thymus images look different in infants, children, teens, and adults. And normal lab results are also different ranges when you look at different ages. So we need just a lot more data to generate the volume of age-specific data that we'll need to generate this. Dr. Mello, you know that Packard Children's, where I trained, is connected by a hallway to Stanford Medical Center, and that kids and adults go to the exact same emergency department. And I just believe that children in that ER should not get the short end of the stick. And we not only need more tools for pediatric use, but we also need the existing tools to be clearly labeled so that providers know if the software they're using is actually intended and safe for kids. Dr. Ibrahim, given the variability and complexities of pediatric care, but also acknowledging that we need this cutting edge technology that makes doctors better and the doctors make AI better, what can be done to incentivize and increase the development of AI tools for pediatric patients?
Thank you so much, Dr. and Congresswoman, for your question and highlighting the differences between pediatric and adult patients. Our current product has been only on adult patients, recognizing that it is an entirely different specialty to be able to apply those tools. Underscoring much of it is the sharing of data. I'm encouraged that the field of AI development has progressed in this space where we're able to share not the actual individual data, but the weighting of our algorithms from our data across institutions in a way that we can benefit from sharing the data without actually exchanging the individual patient's data. Pediatrics, that's particularly important because just the sample size is much smaller. So incentives and even national efforts that would help institutions aggregate this information, that they could share it in a way that maintains privacy without the individual records being dispersed, but being able to share the weights of the algorithms would be incredibly helpful, for adults, in fact, as well.
And do you have ways of not only incorporating the pediatric radiologists at Children's Hospital, but also specifically pediatric radiologists at outside hospitals so that everybody's involved?
That's a great point. I think one of the hidden benefits of AI is that the IT infrastructure has had to improve significantly to enable the AI technology to do what it does. One of the things has just been the exchange of radiologic images. So we've had a number of hospitals say, thanks for being able to just share the images. We're not sure if we want to use your AI tool, but you at least got us to that part. So
thank you. I'm going to just quickly, I don't have time to ask you the question, Dr. Mello, but I just want to bring up the issue of physician liability, that when you have AI giving one answer and a physician giving another answer and something goes wrong, I think we need to think hard about where the liability is. Is it on the AI company or is it on the physician? And the toll that that takes on physicians also to be a checkpoint and also to just be a reviewer of loads of data. Thank you all for your testimony. I yield back.
Thank you. The